Hi, Dr. YASS here. This video is made for the hundreds of thousands, if not millions of people globally who have had a hip or knee replacement and still have the same, if not greater, pain after the surgery as before the surgery and are wondering what their next step should be. Again, before I continue further, I just want to thank everybody who have been giving me the thumbs up on all the videos I've been providing on my YouTube channel, Dr. Mitchell YASS. It means a lot to me to see the incredible positive response to everything I'm putting out. Again, I'd like to invite you to subscribe to my YouTube channel, Dr. Mitchell YASS. If you like the type of information I'm providing, I will continue to provide it. The type of information is highly applicable. It's the type of stuff that helps guide you towards your own understanding of what is causing your pain and the best way to resolve it. So again, thank you. For all those people who have had surgery, hip and knee replacements, and are still in the same boat, if not worse. And when I say worse, I'm talking about the level of dysfunction that occurs after the surgery. So maybe you were at the point where you were limping when you tried to walk, but now you require a cane or a walker after the surgery. This should be a wake-up call that the surgery not only wasn't effective, but wasn't warranted. It's actually increased your symptoms, your inability to function. The point I would like to make to people is the idea of changing joint surfaces has nothing to do with the ability to perform functional tasks. So if beyond the pain you're experiencing, and we can go into where the pain is and how it would have to be strictly in the joint, nowhere else, if you have connected dysfunction, an inability to walk, to climb stairs, to kneel, to reach, to sit for an extended period of time, anything that relates to a functional deficit associated with the increasing of your symptom or the bringing on of your symptom, then you must recognize that the joint itself has nothing to do with the cause of the symptoms, and the structural variation identified was simply an independent variable, the arthritis, the meniscal tear, the labral tear, whatever. You have to recognize this because it's the only way you're going to protect yourself. The idea that you're going to go to a surgeon and somehow they're going to say, oh, surgery is not required. Let me please evaluate you and explain to you how you have a muscular cause creating the symptom and that the structural variations which I alter through my surgery are not the cause of your pain would have to be insane. It could never happen. Only you can protect yourself, and the only way to protect yourself is to have the adequate information necessary to protect yourself. Going to a surgeon and asking them to protect you is just pie-in-the-sky thought. It just makes no sense. Think about what happens after you've had that failed surgery. And you go back to this person. And you say that you're still having pain. I just treated a woman 3 years after her hip replacements, bilateral hip replacements. She's using freaking crutches to function. She can't walk up one step. 3 years after bilateral hip replacements, and she's being told she now needs bilateral knee replacements. She says to the surgeon, why am I still having the same pain I had prior? And he says, I don't know. I don't know. But he got paid for the bilateral hip replacements. The woman's using crutches, still has pain, can't walk up a flight of stairs or even a stair, and is being told that she should now accept this person's understanding to get bilateral knee replacements. Does this sound like your story? Of course it sounds like your story. This is your story. This is everyone's story. Globally. It has to end, and the only way it'll end is if you walk away from the system and recognize that the YASS method is the only method that can identify muscular causes through the interpretation of symptoms. No other method, no other medical practice understands the idea of interpreting symptoms because they are dependent on diagnostic test findings, period. You must recognize that every bit of evidence has shown that this is a failed system. The number of people getting revisions of hip and knee replacements is astronomical. They're being done a month, 2 months after the original surgery. You're being told that it doesn't fit properly, the cement didn't take, it's not the proper size. That's a bunch of crap. It means nothing if the original symptom is the same after the surgery as before. It tells you, most importantly, that the surgery was not addressing the tissue in distress that was eliciting the symptom initially, which is muscle in more than 98% of cases. This is your chance. If you're willing to go back to the surgeon after the failed surgery, first surgery, and accept them as being the one that you would believe and trust to move you further in your ability to resolve your symptoms, including pain and dysfunction, I think the evidence will show you are making a critical mistake. It is time for you to get the YASS method, the only method that interprets the body's presentation of symptoms to identify the tissue in distress that is responsible for your symptoms. And in 98% of the cases, that's muscle. And muscle is never going to show up. You're not going to find a muscular deficit on an X-ray or MRI, and sure as hell, you're not going to find any medical practitioner to identify that as the cause. So it's up to you now. If you want more information about the YASS method or how it can help you, please contact me at drmitch@mitchellyass.com, DRMITCH at MITCHELLYASS.com, drmitch@mitchellyass.com. If you would like a Skype or Zoom session, regardless of where you are on the planet, I've done this for people all over the world at this point. It's not a new thing to me. I've been doing this for years because of the demand for people recognizing that this method, upon hearing about it, is the most logical means of diagnosing and treating pain and other symptoms. You can get a Skype or Zoom session with me by contacting me at my email address, drmitch@mitchellyass.com, drmitch@mitchellyass.com, drmitch@mitchellyass.com. Please think logically. Please think for yourself. You've had the failed surgery. Now what are you going to do? Don't go back. That is simply foolhardy and will lead to further surgery and further decreases in function. Get the YASS method. It makes sense. There's nothing invasive about this, and in fact, if I am right and the cause is muscular, within weeks you could be pain-free, fully functional, and you will no longer be a prisoner to the medical system. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.